Uh, I'm Pamela Michelow from Johannesburg, South Africa. I've got a joint post, University of Witwatersrand and National Health Laboratory Service, which is the public sector laboratory service in South Africa. And I'm also on the executive committee of the International Academy of Cytology. So I'm going to not have my camera on for the whole time. I don't know if you know, but South Africa's having terrible problems with electricity. So I think it's just better if I don't use more electricity than I should. Okay, so I'm going to stop the video now and continue with the talk. So I'd just like to thank the IAC for giving me the opportunity to give a lecture on something that that people may not know very much about, which is qualitative research in cytopathology. Page down. Sorry, I just need to get to the next page. Okay. Seem to be working just now. Okay, there. Let me go back. Okay, so so this is the outline of the webinar. I'm going to talk about what qualitative research is and why it's useful, the differences between qualitative and quantitative research, different types of qualitative research design with examples of how one could use it in cytology, how to conduct a qualitative research project. I'm going to give you an example of a mixed method study in cytopathology where both quantitative and qualitative research was done, and then just a very brief mention of ethical considerations. So first of all, what is research? So we undertake research in order to shed light on an aspect that we feel that should be further interrogated. So we do research to fill a gap. And this research can be qualitative, quantitative, or mixed. So this was a really good definition from Bussetto and al. So I decided not to paraphrase it and to use it as is. So qualitative research can be defined as the study of the nature of phenomena and is especially appropriate for answering questions of why something is or isn't. It's also useful for assessing complex interventions with several components and how to improve the uptake of the intervention. So in qualitative research, we generate data in the form of words rather than numbers. And because qualitative research creates insights into behaviours, attitudes, and people's experiences. And it also may be used to inform the development of interventions and understanding why, and create understanding as to why people use or don't use these interventions. So in a nutshell, qualitative research considers why do people behave the way they do or think the way they do, and how they came to develop these thoughts, opinions, and behaviors. And once we know why people think or behave or the way they do, then we can create appropriate interventions and evaluate these interventions regarding the success. So what qualitative research is not. So qualitative research, you get data in the form of words. So it's very hard to quantify qualitative data. So in general, qualitative data is not quantifiable. And qualitative data is not generalizable, but it certainly can provide insights that are useful in similar situations. So just as with quantitative research, in order to undertake a really good research project, with meaningful results, it takes skill and expertise to both collect and analyze the data. And just as with quantitative research, it must be undertaken very rigorously with emphasis on both validity and reliability. So there are some questions in the world that just can't be answered with quantitative research methods. So an example would be, if you wanted to know how many people with TB complete treatment, then you would obviously quantify that. But if you want to know why do some people complete treatment and why do others not complete treatment, You can't do a quantitative study because these are people's beliefs and opinions, and they're just not amenable to numbers. So you would design a qualitative research project, and the information obtained would help you design help you implement something to improve people's uptake of TB medication. So closer to home, given the global shortage of medical graduates choosing to become pathologists, quantitative research can tell you how many medical graduates choose to become pathologists, and the answer is unfortunately very few. But we need to know not only how many, but we need to know why people decide to become pathologists or why people don't decide to become pathologists, because the information that we obtain will be useful to help plan interventions to make pathology more attractive to medical graduates. And in fact, this study was done in Canada a few years ago, where they looked at medical graduates who chose to become pathologists or didn't choose to become pathologists and the reasons for that. So in qualitative research, so it's gaining more traction in health research. And if you look at general medical journals, there certainly is more qualitative research than there used to be. Unfortunately, this doesn't seem to have been translated into pathology, where qualitative research remains extremely underutilized. So in health research, qualitative methods are used to explore complex phenomenon that clinicians, us working in the laboratory, students, patients, and policymakers experience. And by using qualitative research, we can get a rich and deep understanding of the situation, of the meanings that people place on actions, events, and relationships. And because qualitative research often takes place in an actual laboratory or hospital, the descriptive nature allows the researcher to build a complex, holistic picture. And qualitative and quantitative research is equally important because they answer different types of research questions. And in order to understand things, we need to approach them from different perspectives. So I did a quick literature review when I was preparing this talk, just to look at what is out there as far as qualitative research in pathology. And there are a few articles. So there was a survey of histopathology consultants' attitudes towards academic and molecular pathology. If you're looking at people's attitudes, you obviously can't do quantitative research because you need to know what they believe and why they believe that. There was also a qualitative study comparing virtual microscopy and light microscopy for learning undergraduate histopathology. This is the article I mentioned. If not, why not? Reasons why Canadian postgraduate trainees chose or did not choose to become pathologists. And it actually makes for quite interesting reading. There was another article, we issue pathology reports, but we don't know what patients make of them. So this was a qualitative exploration of patients' experiences with cancer pathology reports. Here are just a few more. There was a qualitative interview study of users' experiences and expectations when artificial intelligence was used in a pathology laboratory. There have been 2 articles on perinatal pathology, how clinicians and health professionals, what their attitudes are towards that. Then there was another article on trainers' perceptions of the direct observation of practical skills assessment in the histopathology training laboratory. And then there was quite a recent article, one of the few articles on qualitative research in cytology or cytopathology, which explored staff turnover, burnout, and resilience in cytology reference laboratories. And I think that's quite a relevant study, but if you are going to explore something like burnout and resilience, it has to be done in a qualitative way. So this is just a table I took from an article by Mack et al. Just some differences between qualitative and quantitative research. So in quantitative research, one starts with the hypothesis, which then one tests. And in order to test the hypothesis, you need to obtain data that's more rigid, using highly structured methods such as questionnaires, surveys, structured observations, or in the case of cytology, things like molecular tests, special stains. Whereas in qualitative research, you often don't start with a hypothesis because you don't know until you undertake the study what you are going to find. And you use less structured methods like semi-structured interviews, focus groups, and just observing participants. So in quantitative research, the objective is to quantify, whereas in qualitative, it's more descriptive, just to describe and explain relationships, individual experiences, and group norms. So if you are using questionnaires or surveys in quantitative, it would be closed-ended, but qualitative would be open-ended. And the data one obtains in quantitative research is numerical, whereas in qualitative, it's more in the form of words. And these words could be obtained from audio tapes, videotapes, field notes. So you can see, I got this from Twitter, that quantitative and qualitative research is appropriate in different circumstances. So certainly one isn't more important than the other, but they just answer different types of research questions. And then there's obviously mixed methods, which is a mixture of quantitative and qualitative methods. But this is a topic on its own, so I'm not really going to address mixed methods. Okay, so the research process for both quantitative and qualitative research is similar. One has an area of interest, or one identifies a gap, and then one has to design a study. The study will give you data, the data has to be analyzed, and then the results have to be interpreted together with existing knowledge. So I'm going to concentrate for the next few minutes on different types of qualitative research designs. And these, there are different types of designs. These are just some of them. They certainly aren't all of them. Different designs for taking a qualitative research project include ethnography, narrative analysis, phenomenology, case study, action research, grounded theory, historical research, and there are more, but these are the most common. And the researcher obviously needs to choose the most appropriate design that will best answer the research question or questions. So the first is ethnography, and if ethnography is really hanging out with a group. So you identify a group or a culture that you interested in investigating, and you literally hang out with them. So you immerse yourself into the group or into the culture. So you experience their way of life before attempting to derive explanations of their attitudes or behaviours. So this is a totally made-up example of a study that could be an ethnographic study that could be done in cytology. So it hasn't been done before, but hopefully this might stimulate someone to undertake an ethnographic inquiry. So this hypothetical made-up example is an ethnographic inquiry into a cytopathology fellowship program at the PQR University. So this would be carried out in a natural setting. So the researcher would immerse themselves in the fellowship program and literally hang out with the fellows. So it would involve close face-to-face interactions with participants. So you'd chat to and you'd observe the fellows, you'd observe the interactions with each other and with other staff. You'd observe them at the microscope, you'd observe them preparing specimens, you'd trot along after them when they went to FNA clinic or went for rapid on-site evaluation, and you'd sit in on formal and informal teaching sessions. And if the study is undertaken properly, you'd get an accurate reflection of the fellows, of the participants' perspectives and behaviours, and the reasons that they feel that way. And then once you've undertaken the study, you can then use the information to improve the fellowship program at the PQR University. So this would just be, this is just one example of how one could use ethnography in a cytopathology setting. Another type of research design is narrative research. So we all, to make sense of our lives and to make sense of the world, we all tell ourselves stories and tell each other stories. And narrative research assumes that because humans organize their memories and experiences through stories, these stories contain messages about the nature of reality. And in both telling stories and interpreting one's experiences, the narrative mediates between an inner world of thoughts and feelings and an outer world of observable actions. So in narrative research, the focus is on the structure and content of communication, and this can be both spoken and written. And examples of how you would use narrative inquiry include getting people to tell you their stories. You could interview, make it a little bit more structured. You could look at people's journals, at their diaries, if they give you access. You could look at photographs and other artifacts, or you could use a combination of all of them. So again, this is just another made-up study on how one could use narrative research. And this example is using narrative research into retention of cytotechnologists. So cytotechnologists are a very valued member of staff, and when one cytotechnologist leaves the laboratory, it's a huge loss. Again, like cytopathologists, there is a shortage. So laboratories certainly don't want to lose any cytotechnologists. So in order to keep them in the laboratory, you could recruit a small number of cytotechnologists as study participants, and you would listen to their stories about their experiences in cytology, why they leave, and then you would write a story about their life experiences, highlighting specific themes that emerge with respect to cytology and leaving laboratory employment. With qualitative research, one often goes back to the participants and ask them to read sort of how we've analysed it to make sure that we've captured what the participant says and not what we think they say. So you would validate these findings by showing the research to the participant and making sure that it's the correct interpretation. And then once the research has been done, you could use it to implement changes in the laboratory to ensure that cytotechnologists stay with you. Another type of qualitative research design is phenomenology. Never mind phenomenology being a difficult research design to understand, it's also quite difficult to pronounce. So phenomenology is based on the philosophy that that reality that the only reality there is that's experienced by someone, and nothing exists outside human consciousness. So in other words, the ultimate source of all meaning and value is the lived experiences of someone. And so research would involve investigating a phenomena that participants experience. And phenomenology is a way to understand individual situations in detail. And to undertake a phenomenology, you can use interviews, conversations, observe participants, action research, focus meetings, and analysis of personal texts. So basically, phenomenology is particularly effective at sort of highlighting experiences and perceptions of individuals from their own perspective. And therefore, it's useful in the situation where, you know, you want to change something, or you think there's a problem and people say, but it's always been done this way. So phenomenology is quite useful to challenge these structural and normative assumptions. And phenomenology can be used as the basis to tell us what is happening, if we should be continuing in this way, or if the policy or action needs to change. So this is another hypothetical example, something that could be done using phenomenology, an investigation into pathologists and clinicians' lived experience at rapid on-site evaluation. So rapid on-site evaluation is certainly part of contemporary cytology practice. If you are offering a service, it would be good from time to time to just look at it and see if it could be improved. So to do this, one could recruit cytology participants and their clinical counterparts who regularly undertake rows, and one would conduct one-on-one in-depth interviews with these participants, the cytology and the clinical participants, and one could also organize a focus group eliciting information about participants' actual experience at rows. One would analyze and report the data, and based on the results, implement changes to improve the row service at one's institution. So these research designs can be quite confusing, but just a brief summary between these three types of research. So ethnography, you would immerse yourself in a particular cultural group of people. And the example was immerse yourself into the fellowship program of a university. Narrative research involves interpreting stories to understand how people make sense of what happens to them. And phenomenology involves investigating things through people's lived experiences. I'm just going to include one more type of qualitative research design. This is a so-called case study. So just to emphasize that a case study in qualitative research is really, really different to a case study in the medical literature. So we're used to a case study as being that. So we're used to someone writing up a single case. It might be interesting, but it's generally just one case. In qualitative research, a case study, you look at a situation using various sources and through various lenses. So you look at a situation through multiple perspectives, which is really different to one case study. And the aim is to reveal multiple aspects of the situation and develop a rich description. And this would provide tools for researchers to study complex phenomenon. So you wouldn't do it for a simple intervention that you've introduced, but for studying complex interventions or complex phenomena in your situation, a case study is a very useful tool. And it can be used to develop theories, evaluate programs, and develop interventions. Again, this is a hypothetical or made-up case study just to show how this could be used in a cytopathology laboratory. So you could do a case study analyzing the process that was undertaken when a particular laboratory was digitized. So if one wants to move to digital pathology or digital cytology, it's a huge change. And you can't just look at it from one perspective. You need to look at it from multiple perspectives to get a picture of what's actually happened and what is happening. So one could use, one in a case study uses several sources of data. These would include documents, and you could use things like workloads, diagnoses, results of quality assurance activities. You could interview several relevant stakeholders like pathologists, technologists, computer staff, clinicians. You could ask patients what they think of their specimens being read by a computer helping with diagnosis. You could observe the various processes. You could observe the actual workflow of how a specimen gets to the laboratory and what happens when it's digitized all the way up to a report being generated. One could use focus groups, one could use surveys or questionnaires. So by using these several sources of data, you get a holistic understanding of how the process occurred. And at the end of it, you can see what worked, what could have been done differently, what changes should still be implemented. And you could also, other labs considering moving to digital pathology could learn from what you've discovered in this case study. So when I mentioned right at the beginning that qualitative research is not generalizable, but can be useful in other situations, where people are experiencing similar things. So here, a lot of what you learned would be generalizable and would be useful to other laboratories, but it's obviously not totally generalizable because, you've used different equipments, the workflow might be different, people's opinions might be different. So while some of it will be generalizable, not all will be. Okay, so going back to our research project, I discussed some type of qualitative research designs in quite a lot of detail. I'm now going to move on to collection and analysis of data. So with data collection, in quantitative data collection, one generates measurable things, like you do an experiment and you score the intensity of the immunocytochemistry stain, or you look at a tumor and you see what percentage of tumor cells carry a particular mutation. Or you could use checklists or rating scales. You could use ratios like the ratio of lymphocytes to neutrophils and closed-ended questions. Whereas in qualitative research, you don't know what you're going to find until you undertake the study. So you would look for patterns, you'd look for similarities, you'd look for differences, you'd look for themes. The questionnaires would be open-ended, where it's not just a yes or no answer. People actually have got to write or say what they think. You could use semi-structured or open-ended interviews, focus groups. You could look at documents. You could observe participants, and obviously if you observe participants, you would use the notes that you made while undertaking this observation. So once one has collected the data, you obviously need to analyze the data. So whereas quantitative research yields numerical data, qualitative research yields mainly unstructured text-based data. So as well as text-based data, qualitative research can use several modalities. One could use photos, artworks. One could conduct audio interviews or video interviews, and sometimes these are used together. So once you have your data, how are you going to analyze it? So there are several ways to analyze qualitative data. I'm just going to talk about thematic analysis because that's a common way of analyzing data, but certainly if in the appropriate situation, all these others are as important. So thematic analysis, as I've just said, is a popular method for analyzing qualitative data, and it's a way of identifying, analyzing, and reporting repeated patterns. So one looks for similarities in the text. And one of the most well-known ways to undertake thematic analysis is the six-stage approach by Braun and Clark, which first came out in 2006 and was updated in 2020. So in qualitative research, you are often the research instrument. So often you will be doing the interviews and you will be analyzing the text and you will be taking the focus groups. So it's very important to know where you're coming from, because you don't want your biases to influence the report. So as well as being very reflective of one's personal opinions, thematic analysis is best done with more than one person. If you've got 2 or 3 people analyzing the same text, then you're more likely to get a more accurate depiction. So the six-stage approach by Braun and Clark. So in the first stage would be one has to familiarize oneself with the data. So you really have to immerse yourself in the data. You've got to read it and reread it and reread it. So you become extremely familiar with it. And this data could include interview transcripts, policy documents, a series of journal articles that you're undertaking thematic analysis on. So once you've really become familiar with the data, you need to create initial codes. And in creating initial codes, you distinguish meaningful similarities and differences within the data. And by doing that, you divide the data into more manageable segments. Then you examine the codes, and some of them may fit together, some of them may not fit together, to identify significant broad patterns of meanings or themes. So you combine or separate these codes into what fits best together in order to generate these themes. You then need to review the themes. You need to check the initial themes against the data just to make sure that they're the correct themes, that they tell a convincing story of the data and can answer the research question. And in this stage, the themes are typically refined. So they may be combined, they may be split into different themes, or they may be discarded altogether. The fifth stage of thematic analysis is naming themes. So you develop a detailed analysis of each theme. So you determine the story of each theme, and you normally then name the theme. And the last step of the six-step process is you need to ascertain associations and connections between the themes. How do the themes relate to each other? And how do the themes relate to what is already known, what is out there in the literature, in order to sort of create a more holistic picture of what has happened or what is happening. So I'm just going to give an example of a mixed method study that I undertook, and I used thematic analysis. So at the start of the COVID-19 pandemic, in order to stop COVID spreading, many countries rapidly instituted lockdowns, curfews, and quarantine. But however, according to UNESCO, they said governments should see higher education as integral to the economic and social recovery. And they said that higher education should not stop, it should continue, but continue with equity. And this led to the institution of emergency remote teaching, or ERT. So the move to digital learning in many institutions of higher education began quite a few years ago, but the uptake wasn't great. But once the pandemic hit us, it fast-tracked digital learning, digital teaching and learning, and within a few weeks to months, an immense difference occurred in how teaching and learning happened. And people used synchronous and asynchronous video conference platforms, such as what we're using now. And in cytology, they use things like whole slide imaging. So the pivot to AP online and teaching can be deemed quite a change. So it's valuable to know how consultants and trainees perceive the shift, if and how their teaching practice changed. And once the pandemic was over, or more realistically, once we began to live with the pandemic, what would they like to happen? Would they like teaching to go back to face-to-face? Would they like teaching to continue in a digital format, or would they like a hybrid model to be adopted? So the aim of the study was to evaluate consultants and residents' opinions and practices regarding the move to digital teaching and learning. And in order to undertake this, 2 pathology centres in South Africa were sent a questionnaire, online anonymized questionnaire, and the questionnaire consisted of both a quantitative and a qualitative part. The qualitative part used phenomenology, so we wanted to know people's lived experiences of moving to a digital format. So the quantitative part included yes/no questions and like-it type questions. And the qualitative data was analysed by thematic analysis. So two of us undertook the thematic analysis. So the first three parts were undertaken separately. So we both familiarized ourselves with the data by reading and rereading the transcripts. And then we developed initial codes to put the data into manageable segments, to look at likenesses and differences. And then we combined different aspects into themes, depending on which codes fitted well together. And at that stage, we then reviewed the themes together to look at, what themes we had both come up with. Were they similar? Were they different? Which ones we should keep? Which ones we should discard? The themes were then named in order to express their meanings in a concise way. And the results of this were interrogated and contrasted with relevant literature to provide a comprehensive discussion. So 38 responses were received from 20 consultants and 18 residents. And the main themes that emerged was digital connectivity, advantages and disadvantages of digital training, and future directions. So as far as digital connectivity goes, all respondents had access to a device in which to participate in online teaching and learning. But even though people had access to a device, there was a lot of dissatisfaction with connectivity and bandwidth issues. People complained they had to use old computers, the networks were very slow, they didn't have enough bandwidth, they landed up using their own data. Obviously, if we are going to continue with online training, then we certainly need to improve both the software and the hardware. The second theme that emerged were the advantages and disadvantages. And I'm not going to go through all of them, but these were the perceived advantages. And in qualitative research, one often supports one's statement with quotes, verbatim quotes. So something like the ability to continue with training activities. And this was supported by the statement, "I'm very thankful that we were able to continue our academic program in a way that kept us safe." Another sort of advantage that people identified was participation by different departments. And someone said that this has broadened our horizons. Participants certainly identified disadvantages, such as less discussion in a digital format, things like distraction, feelings of intimidation to ask questions. Some people felt that it was easier to ask questions in a face-to-face format rather than online. And again, each of these points are backed up with quotes. Just some more perceived disadvantages. What was interesting is that the quality of training was deemed inferior. So studies have shown that online teaching and training is not inferior to face-to-face, but people in the study seem to think that it was. And then the third theme was future directions. This was mainly quantitative, and people said that things like journal clubs, clinico-pathologic meetings and research meetings should continue online, whereas histology and cytology microscopy was better done in person. And in fact, that's what we've done in our academic program. We now have things like journal club online, but we have microscopy sessions at the actual microscope. Okay, so this was a summary of the findings. So in qualitative research, it's very important to ensure validity and reliability. So because you are often the person, the actual research instrument, you've got to see where you are coming from. You've got to know your own personal biases, and you've got to keep on reflecting. Am I interpreting this according to what the person's saying to me or what I think I want them to hear? So you have to be continually reflective and really sort of note your personal biases. You need to keep meticulous records, and It's always good to use multiple sources of data, including different methods and perspectives. And this is called triangulation. You need to be transparent. So when you write up your results, you need to clearly explain how you analyze the data and how you came to those particular conclusions. Again, it's good to do qualitative research with someone else just to reduce this bias. And it's to back up your statements. To improve validity, you need to include rich and verbatim quotes that participants have given you. So in this particular example, where we looked at the pivot to digital teaching and learning, what did we use to improve reliability and validity? We garnered opinions from both consultants and trainees, and we used 2 universities. We used both qualitative thematic analysis and a quantitative approach was employed. 2 people undertook the thematic analysis, again, to reduce bias, and verbatim quotes were included to support conclusions. So while we're on the subject of data analysis, so software exists to support qualitative research, and most universities will have at least one package, software package for qualitative research. So qualitative research is non-numerical and can be collected from a wide variety of sources, and there can be an enormous amount. So while software won't do the study for you, but it certainly can help you organize, process, and analyze data for actionable insight. So if you are considering qualitative research and you are going to be collecting a lot of data, then I really do suggest that you use qualitative research software. Briefly, I'm just going to mention ethical considerations. So whether you do any type, whatever research you do, it has to conform to the highest ethical standards. And it needs to be designed in a manner that's least harmful to both the participants and to the researcher. Obviously, participation has to be voluntary. You can't force anyone to be part of a study. You need patients to understand what the study's about and to sign consent. You need to ensure anonymity. And in qualitative research, it can be more difficult than quantitative research. So if you're taping people's interviews, then don't ever refer to them by name, rather just refer to them by a participant number. And if you are videotaping them, then it can be even more difficult because you can see the person. And but there are sort of tips on how to promote anonymity in video interviews. Obviously, data has to be stored securely in whatever type of research you do. But with qualitative research, there will be power dynamics. You know, the participants may feel inferior to you. So you've got to try and make the whole process as democratic as possible, because you want patients or you want participants to tell you what they really feel. You don't want them to be scared of you and not tell you things, and you don't want them to tell you what they think you want to hear. So you have to be as democratic as possible. And to do this, you've got to develop and maintain a trust between you and the participant. So in conclusion, quantitative, qualitative, and mixed method research answer very different types of research questions. So as I mentioned before, one's not more important than the other. They're just used in different situations. And qualitative research creates insights into behaviours, attitudes, and people's experiences. When one does any type of research, one has to do it to the highest ethical standards. Because you are often the research tool, you need to be aware of your own biases, and you need to be aware of power dynamics when you conduct interviews or focus groups. Different types of qualitative research methodology and data analysis exists, and you obviously need to choose the one that's most appropriate for your research question. It's important to ensure research validity and reliability. And lastly, consider qualitative research software to assist with data organization and analysis. So that's my talk. Thanks so much for listening, and I'm happy to take any questions. And if you have if you have undertaken some qualitative research, then I'd really love to hear about it. So if you could share that, that would be great. Thanks.
Well, this is Alison in Freiburg. I've been watching the chat. There is a question from Greta in South Africa. Her question is, how would you calculate the sample size for a qualitative study?
So for qualitative study, you can't calculate sample size beforehand because you don't know what you're going to find until you start the process. So what you would do is you'd interview people or hold several different focus groups until you get what's called saturation. So once you've interviewed enough people or sent out enough questionnaires that you start getting some similar answers and nothing new, then you'd consider that it's saturation, and then you would say that, okay, that's enough.